I don't really know what causes that. Sometimes they will tell you to drink mojedru or all that. I don't know. So let's do some education. If we say anemia, what are we talking about?
Okay, so it has to do with your let me say the level of amount of blood you have, or the concentration of the hemoglobin in your blood. Okay, and the hemoglobin is what carries oxygen to all the tissues in your entire body. So when the hemoglobin is not enough, that means the tissues are not getting enough oxygen.
Okay.
Yes, that is actually what is called the anemia.
Okay.
So most often we characterize it with the hemoglobin level, the hemoglobin concentration in your blood. Yes.
The way you say hemoglobin, it sounds technical. Sandra, I just want, is it like you don't have enough blood or what? What is it? Because I want to get understanding.
Yeah, so there are different types of anemia.
Okay.
We'll get into it.
Okay.
But so you sometimes you have enough red blood cells, but you
Okay.
don't have enough hemoglobin.
Okay.
Or sometimes you don't have enough red blood cells at all. Yeah.
Because I know the last blood donation that we did, there were some people who were not allowed to donate because they said they don't have enough blood. Is it the red blood cells or hemoglobin?
I'm sure it's more likely the hemoglobin levels were low.
Were low.
Yeah.
Okay. All right. So let's get into the types of anemia, and maybe we can look at what causes anemia.
Okay. Well, the types of anemia, in different circles, you might categorize it in different ways. I chose to do it acquired anemia, inherited anemia, and then those which can either be acquired or inherited.
Okay.
Yeah. So the inherited anemias are what we know as the sickle cell thalassemia. That one has to do with a problem with the shape of the should I say the hemoglobin molecule.
Okay.
And it affects, so it's from a genetic standpoint, and it affects the shape of the red blood cell when the red blood cell is formed. So it can't carry the normal amount of oxygen it's supposed to carry. So the blood volume might be okay, but the hemoglobin concentration, because of the shape of the blood cells,
will be low.
Yes. So
that is acquired.
That's inherited. Yes, so that one is from your family. You can't really do much about it.
Okay.
Then the acquired one, that's the common ones, usually from diets, especially iron deficiency, sometimes deficiency of vitamin B12 or deficiency of folic acid, vitamin B9. Yeah, and then the acquired, another one is blood loss. Okay, so either heavy bleeding or light bleeding over a period of time. So usually ladies with heavy menstrual flows, or maybe if you are in an accident or you have a cut and you are losing a lot of blood, and then hemorrhoids, they lose blood quite slowly over a longer period of time, and then they end up also anemic. Then there is hemolysis, where the blood cells are ruptured. This occurs, the commonest one is malaria, when the parasite ruptures the blood vessels. So you are losing blood, but not in the overt sense. So that one will be coming out in the urine, and the urine will be looking like Coca-Cola like color. So that's like you are losing blood that way.
Okay.
Yeah.
Okay.
And that can also occur in severe infections as well. You can have hemolysis as well. Yeah. Then we have the anemia of chronic diseases. So a disease like cancer, kidney disease, thyroid diseases, liver diseases can also lead to anemia through different mechanisms. Sometimes you actually lose blood. Sometimes the body is not able to produce the blood and all that. Yeah.
Okay.
So that's the acquired. That's acquired. Then we have those that can either be acquired or inherited. We have pernicious anemia. That one you can either be born.
Today you are talking as brofopa.
I'm explaining. So those are their names. So I can't.
We don't have local names for it.
Not that I'm aware of. So it's either you are born with an inability to absorb the vitamin B12 into your bloodstream through food, or maybe through some problem with your your tract, maybe some infection or disease, or maybe you had surgery and you remove some parts of the intestines and stuff like that. So the body can't absorb the vitamin B12, and that will lead to anemia, because the B12 is also part of what helps to create creates the hemoglobin molecules.
Okay.
Yeah.
Okay. I guess the causes are inherent in the explanation that you have given. So let's look for the symptoms. If we say somebody is anemic or somebody has anemia, what symptoms are we looking for?
Okay. So symptoms, the person will always be feeling fatigued or very easily tired. So maybe let's say from your office to the staircase, and the person will just be feeling tired as if they've run a long journey or something, or do like some small labor, washing clothes. They'll wash one shirt and then they feel very tired. So they get fatigued very easily. That's one of the commonest signs. Then there's dizziness, there's headaches, so they keep getting headaches very frequently. There's palpitations, so they'll feel that their heart is beating very hard or beating very fast. Sometimes it may be associated with chest pain. And there's also insomnia. Sometimes they will not be able to sleep at night. Okay. Yeah. And then the pallor, looking pale. So usually you see that in the hands, especially children. You can easily see in the hands. Some people, I don't know, maybe their skin pigments also affect the palm. So
some they're always looking pale.
So
but it's possible to be anemic and not necessarily show it, like, looking pale and all that. Is it possible? Because usually to the naked eye, I think that's the easiest way to spot somebody who is anemic.
If it's mild anemia, yes, you might not see the person being pale. But if it is a severe anemia, you'd clearly see if not in the hands, the inner aspects of the lower eyelid.
I remember when we were kids, my mom, she used to like.
Yes, so the inner
she's not a doctor too.
Your lower
How are they able to see that?
No, it's supposed to have a pinkish color.
Okay.
So when you look there, someone who is anemic, you see it's very pale. And people who are like very, very low anemic, HB of 1, 2, that one is like white, like a paper, white paper. You see it there, then you know that the person is severely anemic. Yeah, and then sometimes there's frequent infections. So small time they get infections, either respiratory, urinary tract. They are prone to more infections that way. And then not difficulty in breathing, like shortness of breath. It's like a sign of tiredness. So they walk a short distance, and as if they have been running for long, the way they are breathing.
Okay.
Yeah.
Okay. All right. We're looking at anemia today on Hello Doc here on the Drive with the Area Gang, and we have Dr. Emefa Jide from the Wejagbawe Municipal Hospital with us this afternoon. Now, let's look at the treatment options for anemia, Doc.
The treatment options. Okay. So the treatment options depends on what is causing the anemia. So if your anemia is being caused by heavy menstrual flow, then that one, the gynecologist will be able to help you with sometimes it's fibroid that is causing the heavy menstrual flow. Sometimes it's a hormonal imbalance that is causing the heavy menstrual flow. So depending on the cause of the anemia, if it's dietary, which is actually the commonest cause, that one they will just give you iron supplements to take, your mojadro and those kind of, it's either capsules or the syrup, and those kind of things. So those actually help. So it really depends on what exactly is causing it. If it's hemorrhoids, then you know that you need to treat the hemorrhoids for the bleeding to stop. Otherwise, you keep taking mojadro, but still the levels of the hemoglobin will not come back up because you are still losing the blood. Yeah. Okay.
Now, do we have any possible complications if anemia is left untreated for a period?
Oh, yes. Very much so. So, the commonest one that I see a lot is heart failure.
Heart failure?
Yes.
From anemia?
Yes.
Whoa.
So it's actually quite common. So when it's not treated, the body has to find a way to get the oxygen to the cells. So it's like fewer people doing the same amount of work.
I'll never associate anemia with heart failure.
Yes.
Wow.
So the heart goes over time to try and then supply everyone because the HB is not enough. And then in that sense, it's overworks, stresses it out. Sometimes it can cause what we call a cardiomyopathy. So the shape of the heart will end up changing. Sometimes it will become too big and wide, and it won't be able to contract well. And then that will now lead to all the other problems of heart failure. They'll start having swelling in the feet, and it can come up to generalized body swelling. Then it will affect the kidneys, and It's
Wow.
a slow death.
Yeah, slow killer.
Yes. It's not good at all. So
Now, since you mentioned that the dietary one, that dietary anemia is like more common, let's look at some dietary changes that one should actually look out for if they are anemic. What should we be eating and what should we not be eating?
okay. So iron is actually the most should I say the most important, or yes, let me say it that way, the most important, the one that is needed in like the most quantities. Yeah.
Okay.
So you need just an iron rich diet. The best source of iron in the diet is more of the animal sources. That's lean meat, not the fatty part of meat, but lean meat. So the beef.
I don't know if this is the only time where animal sources are more important than the plant sources. Usually we're made to believe that whatever you're looking for, the plant sources are better.
The animal sources is absorbed easier and faster into the body.
Okay.
So you get a better response that way.
Okay.
Yeah.
So lean meat.
Lean meat, yes. Eggs, chicken, those kind of things. Liver. That's actually quite high, but it's not good for pregnant women. So pregnant women who think they are anemic, please don't go in for the liver. It affects the baby because I think it has a high amount of vitamin A, which can be like affect the baby and the development and all that. So, but anyone else, if you are not pregnant, you can take the liver to also.
Pregnant women, when they are eating food, when they are chewing liver plenty.
Yeah, it's not the best. So seafoods as well.
Okay.
So mackerel, tuna, sardines, shrimps, those kind of things. Then the plant-based ones. So the plant-based ones, we know the green leafy, consomme, spinach, dandelion, the green berries, those, I forgot, abedro,
the consusua,
or I don't know. I don't remember.
Turkey berries, yeah.
Yes, Then whole grains. Okay. So whole wheat bread, those kind of whole grains, sorghum, beans is also a source.
Gobe. If you eat a lot of gobe, you know, be anemic.
But you should know that you have to pair that with some vitamin C foods as well, so that the vitamin C will help to absorb, because it's not as easily or directly absorbable like the animal-based iron. Yeah. So that's it.
All right. I think you mentioned, but let's just go over it again. If you have anemia, if we can increase my risk for other health problems and what we can do to mitigate that.
Yes. So especially with children, it affects their growth and development. So they will get stunted growth and all that. Even though you are giving them all the other things, if they are still anemic due to maybe some other reason. Yeah, so they might also have stunted growth and those kind of things. Pregnant women too as well. It can affect the baby, the birth weight. It can give premature birth and all those other things. Yeah. So,
but how long does a treatment for anemia take?
That one also depends on the cause.
Okay.
Yes, but usually if it's dietary and you are taking the iron supplements, I think with about a month, you should be able to get 1 or 1.5 milligrams increase of the HB. Okay. So the normal HB should be around, let's say, 12. If yours is 9, if you take it for about a month, you should get around 1 plus 1, 1.5. So maybe after a month, it should be around 10, 10.5 thereabout.
Okay. If the anemia is dietary, is it possible for one to come out of it completely at some point in time?
Oh yes, definitely. So once you are able to bring your HB levels back up to normal, some people can even go up to very high levels, and so you just have to be watching your diet. It's just some people don't watch their diet very well, and some people too, especially those on the strict vegan diet, they don't take any animal based anything. Usually they lack vitamin B12, which the highest source is actually from animal products. So then without the vitamin B12, you might be taking all the iron, but still the HB levels will not be coming up.
Okay. I think when we were doing the blood donation, there was a question like that, whether we're vegetarian or something. I don't know. Vegetarians, are they able to donate blood?
Oh, yeah. Yeah. If your HB is fine.
Okay.
The vegetarians are
There
not
was a question like that in there.
Yeah.
I was wondering why.
It's the vegans that they don't even take milk, because
Okay.
a lot of these you can get it with milk and eggs.
Okay. Okay.
But if you don't take even milk and eggs and everything is just plant-based, then you are highly likely to be lacking.
Okay. All right. Now let's just wrap it up. Are there any resources or support services for somebody to manage anemia?
I don't even know how to answer that. Well, you can visit a hospital if yes, but you should just use your basic knowledge, or you can just Google and then see. But normally, if you want to know your HB levels, you have to get to a hospital. They can either do the on-the-spot HB test, or they'll do a full blood count panel, and then you can see how the levels are.
Okay. Is it something that we should be checking often?
If you are not having the symptoms, it's not that often. Once a year should be fine.
Okay. Okay. All right. I don't know if there's anything else you want to add before we wrap it up on today's topic.
Okay.
Are we good?
Oh, I think we are good.
Okay. All right. Thank you very much for coming through. So that is Dr. Emefa Jide from the Wejagbawe Municipal Hospital today, talking to us about anemia. Thank you very much, Doc, for coming on.
You too.
All right. This is the